What physiological triggers cause honeymoon cystitis? Imagine a moment of intimacy turning into a urinary tract infection shortly after. That's what happens with honeymoon cystitis, a type of urinary tract infection that often follows sexual activity. It mainly occurs because bacteria, especially Escherichia coli, find their way into the urethra during sex. The urethra is a short tube that carries urine from the bladder to outside the body, and in women, it's located close to the vagina and anus, making bacterial entry easier. During intercourse, physical movement and friction can push bacteria from the vaginal or anal area into the urethra. Once bacteria enter, they can travel upward into the bladder, where they multiply and cause infection. In addition to bacterial entry, mechanical trauma from sexual activity can also play a role. If the activity is new or vigorous, or if there's not enough lubrication, tiny tears or irritation can occur in the urethral and vaginal tissues. These small injuries make it easier for bacteria to invade and establish an infection. Using certain contraceptives like diaphragms or spermicides can change the vaginal environment, making it more alkaline and disrupting the natural balance of bacteria. This imbalance can promote bacterial growth near the urethra and increase the risk of infection. Urine stagnation is another important factor. If someone delays urinating after sex or does not fully empty their bladder, bacteria can multiply in the stagnant urine. Urinating soon after sex helps flush out bacteria from the urethra, reducing the chance of infection. Poor hygiene practices, such as wiping from back to front after bowel movements, can transfer bacteria from the anal area to the urethral opening. Structural issues like kidney stones or vesicoureteral reflux can also predispose someone to infections. Conditions that weaken the immune system, such as diabetes or pregnancy, can make it easier for bacteria to cause infections as well. From a bladder health perspective, recurrent infections like honeymoon cystitis cause inflammation, which can lead to discomfort and, if untreated, more serious issues. While these infections are mainly caused by bacteria entering the urinary tract, chronic inflammation over time might irritate bladder tissues. However, there is no established direct link between honeymoon cystitis and bladder cancer. Preventive steps are simple but effective. Urinating after sex helps clear bacteria from the urethra. Good hygiene, including wiping front to back, reduces bacterial transfer. Using adequate lubrication during sex can prevent tissue trauma. Avoiding irritants like harsh soaps or scented products around the genital area is also helpful. Maintaining a healthy lifestyle, staying well hydrated, and addressing any underlying health issues can further lower the risk. If symptoms of a urinary tract infection appear, prompt medical treatment is important to prevent complications and support bladder health. Always consult a healthcare professional for personalized advice and treatment options.